Now that we have some solutions that we think may work, it is time to implement them. The first solution that should be implemented is to have a policy that states that a nurse must be with patients being transported that are on oxygen. To do this, there either has to be nurses on the transport team so they can be the ones to transport the patients, or there has to be a resource or charge nurse available to transport the patient. A way to evaluate this implementation is to have the nurses and transport team note every time that a patient on oxygen gets transported without a nurse. They can also document how the transport went when there was no nurse available. Did the patient desat or was the transport fine? The next solution to implement is to have a policy that requires every patient being transported on oxygen to be on a portable monitor. To have this be successful, it is important to teach the transport team about the monitors and how to work them. Then there must be portable monitors available for use. That means that the units must be in charge of them, or that the nurses must notify the transport team that a portable monitor is needed. The valuation of this implementation is the same as the other policy. Have the nurses and transport team note every time that a patient is transported without a monitor and make sure they document how the transport went.